So good day, sir. I am your nursing student for today. I am Diana Marie Alascano. Today, may I know your name,
My name is Gabriel Lingkod Lascano.
your age, sir,
I'm 18 years old.
and your birthday?
May 10, 2007.
So may I check your wristband? So today, sir, the doctor's order is to apply cold compress to the area that you have swelling area or the formation of edema or the inflammation. So I already do your chart that is also indicated that I'll be applying a cold compress. Sir, I'll be checking your skin, so allow me to touch any part of your skin. So sir, can you tell me where's the pain?
Here, ma'am, in my left arm,
And then,
in my lower abdomen.
okay, sir. So I'll be checking your skin if you have any wound or any scars. Okay, so sir. So the equipments that I'll be using is the basin, the washcloth, pitcher that has the cold water, the sanitizing alcohol, and these gloves. As I prepare the equipments, so sir, today I'll be doing the cold compress application so that it reduces the swelling and it also reduces the inflammation or the formation of edema to your skin. So sir, today I'll be applying the cold compress. The cold compress reduces the bleeding, the blood flow of the tissues, and especially the formation of edema and this inflammation. So sir, if you feel any friction to your skin, just a little bit. Is that okay with you, sir? So I'll be providing your privacy by closing your door, and I'll be performing the hand. As I gather all the equipments and perform the hand hygiene and wear the clean gloves, I'll be positioning you in a comfortable position so that our procedure will be easy. So, sir, are you comfortable, sir?
Yes, ma'am.
So I'll be putting the waterproof pad. Okay. So I'll be checking the temperature. So surface part of your skin. So sir, I'll just give this whole compress to your skin. Then I'll be checking it every 5 minutes. So sir, next is your lower abdomen. So sir, I'm going to expose the part of your lower abdomen so that I can put the compress. So sir, I'll leave it in 5 minutes and I'll be checking your skin. So in applying the cold compress, we need to stop the application immediately if any untoward incident or problem occur, or after 20 minutes or the prescribed amount of time. Then remove the cold compress and we need to dry the skin of the patient. So after putting the or applying the cold compress in a prescribed amount of time, we can remove the cold compress and dry the skin of the patient. So sir, I'll be using another product. Dry the skin. Then I'll be disposing the gloves that I use. So after doing the application of the cold compress to the patient and discarding all the equipments that we've used, now is I'll be positioning the patient in a comfortable position where he can relax himself. So sir, can lie down comfortably. Okay. Now is I'll be inspecting the body of the patient where I applied the cold compress. So sir, may I inspect your skin? Okay, reduce the swelling. Okay. So now, sir, I'll be asking you if you feel uncomfortable with our procedure.
Oh, ma'am.
So can you rate or describe your level of comfort? 1 is being the lowest and 10 is being the highest.
At 10, ma'am.
Okay, thank you. As I was done applying the cold compress to the patient, is now the last thing that I'll be doing is the documentation. So now is I'll be documenting the patient's report, the location of the application, time of placement, and time of removal. So the location of the application is the patient's left arm and his lower abdomen. So the time of placement is 9:35 a.m. and the time of removal is 9:55 a.m. Also, the patient said, or as I do the procedure, I'm asking the patient if he feel any tingling or pain. But the patient said that he doesn't feel any tingling or pain while doing the procedure. So the patient's response are very accurate to the information or to the documentation that we've had. So good day, sir. I am your nursing student for today. So may I ask your name, sir?
Gabriel Lingkod Lascano.
Okay. Your age
18 years old.
and your birthday.
May 10, 2007.
So may I check your wristband? Okay. So So today, I already verified the doctor's order, which is, it says that I'll be applying the hot compress to the area that you feel sore or any numbness in your skin. So I've also checked your chart that is being said that I'll also need to apply the hot compress to your skin. So next is, I'll be assessing your skin, sir. So allow me to touch any part of your skin that you feel any sore. So sir, may I ask if where's the part of your body that you feel sore?
Left arm.
Left arm and your
Lower abdomen.
okay, sir. So allow me to inspect your skin. Okay. So your lower abdomen, sir. Okay. So next is, I'll be preparing all the needed equipment, sir. So relax. So the needed equipments that are the waterproof pad, basin, clean gloves, waterproof washcloth, the pitcher that has the warm water, and also the sterile alcohol. So now is I'll be explaining the procedure, which is the application of hot compress. So the hot compress will reduces, or it will help you to increase the blood flow of the sore or the swelling in your skin. So it also helps to circulate the blood flow. So as I gather all the equipment that we'll be using in applying the hot compress, now is I'll be explaining to you, sir, what are we going to do. So now is I'll be applying the hot compress to your sore skin, because hot compress will help you to increase the circulation of blood flow to your sore skin, and it also reduces, or it also makes the healing process be more fast. So now is I'll be providing the privacy by closing the door, and I'll be performing the hand hygiene. So when putting up gloves, you need to remove your wristwatches and any accessories. I've also done the hand hygiene and clean gloves. I'll be positioning the patient in a comfortable position. Sir, allow me to pull up. Okay. Okay. And then I'll be placing the absorbent towel. Okay. So now is I'll be proceeding to the application of the hot compress to the patient. This is all warm water. And I'll be also checking the temperature of the or the warm water. Okay. So sir, while applying the hot compress, I want you to tell me if you feel any tingling or any pain. So sir, is it too hot?
Too much.
So sir, I'll just leave this in 5 minutes and then I'll check your skin after 5 minutes. Sir, next is your lower abdomen. So do you feel any pain, sir?
Too much.
Is the temperature of the warm water is good? Is it?
Okay.
Let me expose your lower abdomen. Okay. So as I said, I'll just leave the hot compress to your skin and then wait for 5 minutes. So sir, after 30 minutes pass by, I'll be removing the hot compress and dry your skin out. So I'll be using the spare of washcloth to dry your skin. Okay. Do you feel good, sir?
Yes, ma'am.
As we done the application of hot compress, I just want you to describe the level of your comfort. If you feel burning sensation, so rate your comfort level. 1 is being the lowest and 10 is being the highest.
It's a 10 minutes.
Okay, sir, thank you. As we done applying the hot compress to the patient's skin sore screen, now is I will be asking the patient if you feel uncomfortable to the procedure.
Too much.
So sir, can you describe the level of your comfort? 1 is being the lowest and 10 is being the highest.
Okay, ma'am.
Okay, sir, thank you. So now is I'll be discarding all the equipments that we've used and also especially the clean gloves that we've used. So discard it in an infectious garbage. So as we done applying the hot compress to the patient, the last thing that I'll be doing is the documentation. So we all know that documentation is very essential for us as a future nurse because documentation will help us to to show the information of the patient or the reports of the patient. So now is the length of time that the hot compress applied is within 30 minutes. So we've started at 1:35 p.m. I applied the hot compress to the patient, and the time of removal of the hot compress is 2:05 p.m. So the temperature of the hot compress or the warm water that we've used is above 15 degrees. Okay. So also I've asked the patient if he feel any tingling or pain, but the patient responds to me that he didn't feel any numbness or any tingling or pain while doing the procedure. So this is the end of return demonstration of applying the hot compress and cold compress.